All right, guys. Thank you everyone for joining today. Good evening, good afternoon, depending on where you are located. Really excited to talk through how to go out of network with vision plans by using Anagram. Today's webinar, guys, I'm going to walk you through the webinar, and then I'm also going to be able to show you how the Anagram tool works. If we do have any questions or concerns as we are walking you through this webinar today, there is going to be a section at the end of the webinar to answer any questions. We'll have about 10 minutes left over at the end. So again, thank you everyone for joining today. Really excited to talk through how to go out of network with vision plans by using Anagram. My name is Ryan, and I have been here with Anagram back when we were still Patch, about 3 years now. The last 3 to 4 years have been a really wild ride. We have implemented our system into thousands of practices, and over the course of that time, we have had the ability to really drill down into what works when going out of network and how we can best support practices that maybe were not considering this path as they wanted to take, or didn't think that they were able to do so. And then COVID hit. Things have changed. We are living in a new world now, and being in network on low paying fee schedules with restrictive labs just doesn't make a ton of sense for many people or providers anymore. So I'm really excited to be here and talk through this with you guys all today. A little bit about me, guys. My dad is actually an optometrist. I have used Anagram within my dad's practice. He practices in Syracuse, New York, and that is actually how I got involved here. So I'd be more than happy to answer any questions or concerns that you guys have regarding the Anagram tool. Taking it from the top, dropping vision plans is going to mean a lot more than just accessing out-of-network benefits. And while we do strongly believe that maintaining transparency and the ability to communicate eligibility to patients and file their claims to give them a seamless experience is critically important when making that decision, you really do need to take it from square one, which could sometimes mean essentially starting a new practice. Now, everything we are going to be talking about today is speaking in a very general matter, and everyone's business is going to be completely different depending on demographic, location. Are you in with all insurance plans? Are you in with maybe one major player? How you decide to go out of network is going to be dependent on your own unique circumstance. And that's why we always suggest that after these webinars is to get in touch with us one-on-one. We can talk through what makes sense for you and your particular needs. But regardless of what your specific use case is, when you do decide to finally no longer rely on vision plans for patient acquisition, you are taking on a new business model. Being out of network, or what we like to call open access provider, again, open access provider, will mean that you do have to consider how patients are going to find you. Thinking through a marketing plan, what your website looks like. Are you advertising on Google, Yelp, Facebook? All of the places where patients value high quality of care will find you, rather than vision insurance patients that are going to the vision insurance portal and may come into your practice and say, I only want what my insurance covers. Some even may argue that those are not the patients we want to be capturing at our practice, because they are wanting everything that is going to be completely free. And I can promise you those are also going to be the patients that give you and your staff the most frustration. The name of the game when going out of network is to appeal to a different type of patient, a patient that is really going to take seriously your relationship, will care about how much time you spend with them in the office, will care about how your staff communicates what's available to them, and then being in a position to offer a wider range of products and materials, having freedom on who you want your frame sent to, who is going to be filling your prescriptions, which labs do you trust, rather than the insurance companies, specifically vision insurance companies, dictating all of those things when you are in network. When you are out of network, you get a say in how to run your practice, and appealing to patients where those details will matter is important. And doing that via different marketing channels is something you will have to consider if you have never attempted to appeal to cash pay patients before. Now, one conversation that we continue to have, especially in a time of a pandemic, is we have been sold a particular model by the insurance companies. They did a really great job at marketing this business model to the entire industry. Back in the 80s or 90s, when VSP was just up and coming, they are talking to us about quantity versus quality. We put butts in chairs. We will get you patients. You are going to have huge volume. And that is how we are going to justify paying you $50 per patient for an eye exam. They have continued to beat the drum to quantity over quality. But now, in a new world where you can't sometimes have a full waiting room, or maybe you only, see a handful of patients per hour, you have to sanitize in between each visit, or, we no longer are living in a world where a huge quantity game makes sense. We want to start to work smarter, not harder. Additionally, as inflation has occurred over the years, but your fees from these insurance companies have not reflected those changes, you end up working twice as hard as you would have to if you were getting paid a fair living wage per patient. It seems to be that every time a new contract comes out with these insurance companies, their fee schedules are either staying the same or their fee schedules are getting lower when your costs and the cost of living is only getting higher. Again, you want to be getting paid a fair living wage per patient the way you can when you opt out of network and have the ability to set your own fee schedules. We here at Anagram really like to focus on the fact that when you are out of network, or again, what we like to call open access, the value of each patient can actually be 2 to 5 times the amount of an in-network patient. Again, the value of each patient when you are out of network can be worth 2 to 5 times the amount of an in-network patient. You are going to be able to also, let's say, close the shop on Fridays because you are seeing more high value patients Monday through Thursday, and therefore you don't have to keep your exam chair packed from early in the morning to late on a Friday evening in order to cover your overhead costs. These factors all come into play when we think about making a transition into a new open access world. Having the freedom to decide how much of your staff you want to be dealing with billing, the materials you are going to be carrying, the vendors that you work with, these are all huge benefits of going out of network. And at the end of the day, you will then again have the opportunity to work smarter, not harder, to make more money per patient and grow the business the way that you see fit. Now, if we are going to get down into the details, how to drop vision plans, which is something now that people, again, are starting to look into. We are seeing people drop vision plans like we've never seen before. And that's really exciting because everyone on this call and everyone within the industry, we are going to start to gain control back of the industry. Again, this is now something that people are starting to look into. So because they just assumed they would be in network until the dawn of time. But with new regulations that have come through, even more restrictions on how people may assist their in-network patients, people are finally ready to pull the plug. Some providers come to us that are entirely in network and they want to jump into the deep end head first and rip the band-aid off of all carriers at one time. Others are interested in starting with their lowest paying plan, the one that gives them the hardest time and ends up making the least amount of money. We are not here to say which way is going to be best for you. Again, it really is going to depend on your staff, your practice, your demographic, and how you've marketed your practice to date. I can tell you here at Anagram, we have customers across the entire spectrum. We have folks that have been working with us since 2017. that have decided back then that they no longer want to accept, let's just say, VSP, IMED, Davis, Spectera, and maybe a few others. They dropped them all at once. We have others that started with us in 2017 who dropped their least favorite plan. And now, fast forward to the end of 2020, mid 2021, they are entirely out of network, but they chose to drop one vision plan per year. There's no right or wrong way, but each will come with different perks. When you drop them all at one time, it makes messaging for your staff a lot easier. They only have one talk track and one narrative to remember, and they can offer the same experience across the practice, regardless who the carrier for the patient may be. If you decide to go one plan at a time, you are able to see how your demographic responds. Where are there areas to improve? And better train staff as they're having these conversations to make sure that they feel more confident and comfortable when having these conversations. It will really just depend on what makes sense for you. You guys know your practices best. After we decide which route we want to go toward, communicating to your patients how the change has been implemented is really important. We're going to want to develop scripts that speak to the value of your practice. Are you gearing to be more medically focused? Are you tired of having shelves full of Luxottica? Maybe you want to help your patients understand why this decision has been made. And we have proven that with an upfront discount, you can actually get them the same, if not a better deal than when you were previously in network, when you weren't allowed to offer, let's just say, discounts, and you were forced to put them into a specific lens sent to a specific lab that could take months to get back their complete pair, or would maybe send back a lens with the wrong prescription. Having an understanding on how we want to frame your transition is going to help consumers understand why you have made the choice. And we are in a place right now in our economy where people do want to give their money to small businesses, to private providers that care about their well-being. In vision care or any other medical specialty, most of us know that insurance is not necessarily in it for our best interest, unfortunately. We don't want our insurance plan to dictate our doctor, and having that be a part of your conversation, while that may sound lengthy and cumbersome up front, patients do listen. They do want to understand how their money is being spent. Maybe you can help them not accept or pay VSP out of their paycheck for $10 a month in the upcoming enrollment. Education's really going to be empowerment here, guys, and that is really an important thing to keep in mind. The final step is learning new processes, implementing new technologies so that your staff has an easy way to make the transition, so they are supported throughout the process, and that they are given everything they need to create a seamless transition, so your patients now are going to be able to know that they can still use their benefits. They get to have their cake and eat it too. It's just going to be a little bit of a different workflow than they're traditionally used to doing. So with that, we are going to jump right into the Anagram demonstration and show you how it works. As you guys can see on your screen here, this is simply just a web-based solution. So what I mean by that is you'll go to our website, anagram.care, click on sign in, just like you would for Facebook, Gmail, any of your web banking accounts. Once we click on sign in, there are going to be 3 tabs on the left-hand side of our screen here that you become extremely familiar with. And that is going to be the patient tab, the claim tab, and the dashboard tab. These 3 tabs here that I'm highlighting are going to be the tabs that your staff will use most frequently. Patients are going to call, they're going to say, do accept my insurance plan. You guys are an open access provider. Let's find out what your benefits are. We'll click on add new patient in the upper right-hand side of our screen here. And first things first, we are going to add the patient into the Anagram database. So you type in the patient's first name, followed by their last name, their date of birth, their gender, and their phone number. We'll click on continue, and these are going to be the 8 different vision plans that we are able to assist you guys with. We work with the 8 most popular vision plans nationwide, and that is going to include VSP, Cigna Vision, iMed, Aetna Vision, Superior, Spectera, Davis, and Blueview. Those are the 8 most popular vision plans nationwide. And believe it or not, they have some of the most robust out-of-network coverage in the entire market. So you'll select whoever the patient has for their vision insurance, and you're then going to type in their insurance information directly into our tool. You can type in their information manually into our system, or in the upper right-hand side, you can actually skip this part, send a text message or an email to the patient. This will allow the patient to receive an intake form from your practice. This will allow the patient to type in their own insurance information right from their phone. So by the time they do arrive at your practice, everything will be auto-populated and pre-populated into the system for you. The nice thing about this intake form is that it does work for both English and Spanish. So if you do have any Spanish-speaking customers, this intake form would be great for your Spanish-speaking patients. Your staff can always just type in the information manually into our tool. You'll type in the last 4 of their social. Your member ID, if they have one, the reason why I say if they have one is because you'll come across a lot of VSP and iMed plans that don't have member IDs, and that's okay. You'll just leave it blank. You'll then put in their mailing address. We're connected to Google Maps. So as you start to type in the patient's address, it's going to auto-populate for you. If you ever come across an address that is not on Google Maps just yet, you can always click on Use Manual Address and type in the address manually. You'll then type in their employer. If they're unemployed, self-employed, or retired, you would select this option here. If they are employed, you will type in their employer. We'll click on continue, and this is where Anagram is going to search the insurance database and populate the patient's vision plan. You see that there's a little clipboard functionality here. This is a great way for your staff to check for any dependents that are on the patient's plan. I also like to suggest to our providers that when you're scheduling the primary card holder for an exam or for a visit at your practice, I always like to have them check for dependents, because then if they have any dependents that are on the patient's plan, you can check their benefits too. If they're eligible for a new eye exam, why not suggest they get that done or get that scheduled as well? So you can say, hey, Scott, you're all set for July 10th for your annual eye exam. It looks like Victor, who's also on your plan, is also eligible for an eye exam. Did you want to get him scheduled as well? We'll click on calculate benefits, and this is going to show you the patient's out-of-network coverage for both services and materials. You'll notice that most of the benefits that you see on your screen here are going to be in green. That means that they are eligible for today's visit. Green means go. You've got the green light. You are good to go. If they're not eligible for today's visit, it will be grayed out like this lens add-on option down here at the bottom. And it will also, to the right, give you a date of when they are next available. So our system's completely foolproof. It's never going to allow you to submit for something that they're not eligible for. On the left-hand side here, we have our insurance guru team. They operate from 6 to 6 Pacific Standard Time, 7 to 7 Mountain Standard Time, 8 to 8 Central Standard Time, and 9 to 9 Eastern Standard Time. If you have any questions, you can contact our insurance guru team. They will be able to respond in just a few minutes for you. If you're contacting our team because you need status on a claim or have some claim questions could take us up to 24 hours to get back to you for a response. We actually have to reach out to the insurance company on your behalf to look into any question you have regarding the claim. From here, we're simply just a plug and play. You'll click on use, you'll put in the cost of whatever the patient's getting done today. We'll put in the cost of their eye exam, their frames, and their new lenses. Our calculator tool is going to show you exactly what the patient's going to owe and what their insurance is going to cover. The patient will pay $450 upfront today at the time of their visit. They'll receive their check for their insurance reimbursement for this example, $160 in about 2 to 4 weeks from their insurance company. Now, VSP allows for something called assignment of benefits. Assignment of benefits means you can actually give the patient their insurance reimbursement. So for this example, they're $160 as a discount upfront today. So what I mean by that is you can give the 160, subtract it from their total of 450, charge the patient 290 for today's visit, and then you as a provider will get a check back in the mail for $160 from VSP in about 2 to 4 weeks. That is only available for VSP and Signavision. All other vision plans, the patient will pay fully upfront and the insurance check will be sent to the patient. Now from here, we are then going to electronically file the claim right within the Anagram software. We'll click on Start Claim, and this is where we are going to electronically file the claim right within our system. This may look like a form that you guys are familiar with or have seen before. It's the electronic version of the CMS 1500 form. You'll put in the diagnosis code. If they have multiple, you could click on Add Another. We'll pre-populate your exam code with the most common codes being put in through our system. You can always change the exam code by typing in exam, and all the different exam options will populate for you. If you know the code, you can put in the code and it will auto-populate it for you as well. So you guys can pick and choose whatever exam code is appropriate for the patient's visit. And then what you'll do is you'll just scroll down all the way to the bottom here, confirm that their gender and that their address is correct. This is where the insurance check is going to be sent to. So at a time where people are moving pretty frequently, we'll want to double check that this address is correct. This is where the insurance check is going to be sent to. We'll click on Submit, and we are all set. We have electronically filed the claim, and now we just need to sit back and collect the check in the mail. When dealing with insurance, I always suggest to send a paper copy to the patient via email. I think it's always best to keep a paper trail when dealing with insurance. You can send it to them via email, or on the left-hand side of our screen here, you can click on Claim, the Claim tab here, and this will show you all of the claims that have been filed within our system. You'll see that the patient we just filed the claim for is at the top. I'll click on View. This will give you the option to either print it out or re-email it to the patient if they prefer. It's essentially going to be an itemized receipt and a summary of their entire visit that they had today. This information is sufficient and good enough for them to submit to their HSA or FSA companies if they're paying with that type of card. On the left-hand side here, the dashboard screen is going to be really important for you guys. And I think that this is a really awesome tool for you guys to keep track on how well the Anagram tool is working out for your practice to make sure that you're getting that return of investment by using the tool. We want to make sure, guys, that your goals that you are trying to achieve with our tool are being reached. If you're in network with vision plans this year and you want to go out of network with vision plans next year, it's cool to kind of put the financials side by side to see how much more money you're actually making as a practice by being out of network with vision plans. You can also categorize the tool by specific users. So if you have 10 staff members and each staff member has their own username and login, you can actually keep track of their performance. This is a great way for you guys to incentivize good habits, such as utilizing the tool, capturing the patient, having them buy glasses and contacts, maybe a second pair of glasses like sunglasses, reading glasses. So we like to say that if you guys want to have a friendly competition and say whatever staff member at the end of the month can utilize the Anagram tool the most, we'll give you, I don't know, let's just say a $100 Amazon gift card. So you guys can use that to, whatever you'd like, or you guys can have a team goal and say, if we are able to have this claim revenue hit $1,000 this month, we can have, an office party at the end of the month. Whatever you guys make sense at your practice and whatever the personality at the office is like. And that's pretty much it, guys. That is the tool from start to finish. We have about 5 to 10 minutes left, so I want to turn it over to any questions. I know there was a lot of information that I said to you guys, so I appreciate you guys listening to me. I hope I wasn't totally boring. I tried to keep it entertaining. I would love to hear from anyone who has a question on something that I may not have covered. And again, feel free to request a personalized demo so our sales team can work with you one-on-one. If you have any questions, you can type them into the little chat bar and I will be able to see them come through. I did see my first question come through. The question states, what is the average out-of-network amount that we or the patient would see on a check? That's a really great question. That is going to depend on whether your question is referring to services or materials. So the average out-of-network benefit that we see for out-of-network coverage for, let's just say, an eye exam is going to be anywhere between $45 and $70. So again, the average out-of-network amount that you guys can expect from the patient's vision plan, again, don't quote me on these numbers because it does depend on the patient's plan, where they're geographically located. But what we have seen in the past is they usually range between $45 and $70. Obviously, the reimbursement is going to be a lot different if you live in New York City versus rural Montana. And then the out-of-network amount for materials such as frames, lenses, lens add-ons like anti-reflective coating polycarbonate, that can be anywhere between $50 and sometimes we've seen it upwards to $100. So again, all of their out-of-network coverage is going to range between $50 to $100. I've seen VSP out-of-network coverage for contacts actually be upwards to $120. Obviously, vision plans aren't going to broadcast that because that threatens their business model. Great question. What are the fees for the Anagram service? That is the second question that I saw come through. I saw some other questions come through and I will get to them in order. That is a great question. Our pricing has changed. We have moved over to a new utilization pricing model. So it's a pay as you grow pricing model. It's an annual commitment billed at $95 a month. So again, it's $95 a month, and then we charge 6% per claim submitted through our system. So it's a new utilization pricing model, a pay as you grow pricing model, annual commitment billed at $95 a month. And then we charge 6% per claim submitted through the system. You're charged at 6% once you submit a claim through our system. Looking up eligibility, looking up coverage, we're not charging that 6% until the claim has been filed through the system. So if you make money, that's when you'll pay the 6%. Now, we do have options where if you do want to pay for the full year up front, we're able to give you a slight discount. So again, speak with your sales representative and they will be able to talk to you about the different options if you pay for the full year up front. The next question is, what is about the average increase in revenue you see for practices that completely drop all vision plans? I love this question because we just did data on this. We just collected the data on this, so I love this question. We are seeing an increase of $2,500 within the first month of dropping a vision plan. Again, on average, our customers that are using Anagram are seeing an increase of $2,500 within their first month of dropping vision plans and using our tool. Yeah, it's pretty crazy, guys. I get people who I speak to. I'm the territory manager for the West Coast out here, and I speak to people who bring their new contracts that they get from vision plans to us, like on the call, and it's really scary to see what these vision plans are getting away with. We do have another question that came through. Do we have consultants that help practices create discount plans after they have dropped? Oh, managed vision care. Perfect, Emily. Excuse me, that was a great one. So yes, managed vision care, MVC, we do. We actually are partnering with many consultants and many buying groups across the entire country. We're actually in the process right now of putting together an 8-step, 3-month course on how to drop vision plans and how to do so successfully. If that is something you are interested in learning a little bit more about, I will provide my email to you guys, the attendees here, and send me an email if you are interested in learning a little bit more about consultants that we work with, buying groups that we work with, frame reps that we work with. If you're looking to drop vision plans but want a little hand holding while doing so, I'd be more than happy to connect you with one of our partners who can help you guys drop some vision plans and do so successfully. I got another question that came through, guys. We have a optical store front and we have an optometrist that is working there. So I am looking to hire an ophthalmologist and believe that other opticals collect much more from insurance companies for medical exams instead of routine eye exam. Is that something that Anagram is familiar with as well? 100%. We talk to more providers more and more every single day who are looking to try to bill medical insurance whenever possible. You are always going to get paid more from a medical insurance plan than you are from a vision insurance plan. Seems like these days everyone has a chief complaint for all the opticians on the call. Just something that warrants an optometrist or an ophthalmologist to bill their medical insurance, such as dry eye, diabetes, something along those lines. Whenever appropriate, I would recommend trying to bill the patient's medical plan whenever possible. A little bit of a pro tip, guys, and this is definitely not something that vision plans would ever broadcast to you. When you're in network with a patient's medical plan, I want you guys to hear me very carefully. If you're in network with a patient's medical plan and you're out of network with the patient's vision plan, you can bill their in-network medical plan for their medical eye exam, and you can then use Anagram to bill their out-of-network vision plan for the refraction, the 92015. Let's hold those insurance companies accountable. Let's put money into your pocket or the patient's pocket, not the insurance company's pocket. It's a great question. Let's get them in for their medical eye exam and use their vision insurance to bill for materials. Let's do it. Thank you for that nice comment. It was a pleasure meeting you, seeing you. We have another question that came through. Does Anagram do marketing? I want to make sure that I'm being very, very clear about what we do offer and what we don't offer. So does Anagram offer marketing? No, we do not offer marketing. Marketing is something that you will have to take into consideration when you are dropping vision plans. In order to keep our costs to an affordable amount of what we are charging today, we aren't able to include marketing at this time. It would require us to raise the cost of our tool. Again, if you do want to send me an email, if that is the main pain point that you are having around vision plans, let me know. We have partners within the industry that I would be more than happy to connect you with, that I work with on a daily basis. They've helped thousands of providers drop vision plans and do so successfully. And that's in areas where people have said, I cannot drop a vision plan. I have to be in network with vision plans. It's not the case. I promise you guys, we have the data. We have successful providers that are dropping vision plans every single day. And it's a great question. There's another question that came through. Do you provide website links for a patient to use to start the Anagram process? That's a very great question. Our tool is always going to be provider facing. So let me share my screen really quickly here with you guys. I know I'm still sharing my screen. Let's see. So the question, guys, was, do you provide website links for your patients to use to start the Anagram process? So our tool is going to be completely provider facing. It's not customer facing. With that being said, once you are in our tool and you click on the specific patient and you are wanting to have the patient enter in their insurance benefits, you are able to send the patient a text message or an email to the patient to type in their own insurance information. But the process of Anagram is done on the provider side. The provider side is the one looking at the benefits. You can always print out the benefits and give it to your patient. You can print out the benefits and give it to the patient, but everything is going to be done on the provider side. All the claim filing process, all the insurance process is going to be done on the provider side. Anagram is going to help you facilitate that process. We just want you guys to focus on what you do best, which is provide that high quality of healthcare and that concierge type service that patients look for these days. We are very well aware of the problem that insurance companies cause for these providers, along with the frustrations. The least favorite part of my job when I used to work on my dad's practice was waiting on hold with Davis Vision for 45 minutes to an hour. Frustrating. I can tell you at least 100 things that are better use of my time than waiting on hold for the insurance company. I don't know if that answers your question, but I think, again, the question was, do you provide website links for our patients to use to start the Anagram process? No, everything's going to be provider facing. You guys are going to be able to use the tool, get creative with it. We'll help you guys facilitate that entire process for you. Again, I'm going to, yes, of course. I'm going to, again, put my email down here in the chat for the people who have not seen it. If you are interested in anything that Anagram is not able to offer, like marketing, programs to help you guys draw up vision plans and do so successfully, please send me an email. I just, again, posted it in there. I'd be more than happy to connect you guys with our partners. If you are ready to sign up with Anagram, obviously send me an email as well. I'd be more than happy to get you set up. While you guys are thinking, if you have any questions, you guys should be really excited. We're going to take back control of the industry. We're vision plan's worst nightmare. But we're just trying to do the right thing. Everyone on this call deals with insurance on a daily basis, and we still sometimes get confused. So we have to imagine what it's like for the rest of our patients who don't deal with insurance every single day. I can't even tell you how many times I talk to patients who have no idea what their insurance covers. I mean, there's part of my insurance that I don't even understand, and I work with insurance every single day. You guys are all very welcome. I want to thank you all for, taking the time out of your Thursday to speak with me today. I hope this was helpful. If you have any questions, we're here to help. All right, guys, thank you so much. Have a good rest of your day, and we will talk to you guys soon.